Welcome, everyone, to the Friends of NPACE Podcast. I'm Terry Schmidt. I'm the Executive Director at NPACE. I'm also a practicing family nurse practitioner and a past academic. And so I am super excited about this show. I'm so thrilled that our guest had time to spend with us because this is an area of passion for me, and that's educating educators. So welcome to Dr. Leanne Fowler. You are an associate professor of clinical nursing and program director for the 7 NP tracks at Louisiana State University Health and Sciences Center, New Orleans School of Nursing. You also are a health policy leader and known for advocating for nursing practice. You're on a governor-appointed membership to the LA Health Equity Task Force. You have an appointment as vice chair of legislative task force. You've led and informed successful Louisiana legislation through commission and task force appointments, resulting in safer working environments, improved care for vulnerable Louisianans, and more equitable health care to older populations. That served as a national model. But you're also the president-elect of the National Organization of Nurse Practitioner Faculties, NOF, which is a friend organization of NPACE, where all things NOF really are behind what they're doing. You lead national educational initiatives there on the Doctor of Nursing practice, but you're here today to talk to us as the principal investigator and project leader for a grant-funded educational project for educators in the nursing workforce. So did I get all that right?
You did. You did. Thank you very much. Thank you very much.
Well, thank you for being here. So tell us, Dr. Fowler, a little bit about how you got into the nurse practitioner education profession. I always like to hear how people became NP educators.
Well, it's very interesting, I think, because I didn't even know that I would be taking this path, but I'm so thankful that I did. So it's for me, it started when as faculty member here at LSU. I was teaching in the critical care course. I loved teaching. I was already master's prepared. And then I learned in order to continue gaining academic rank, that I needed to earn my doctorate. So when thinking about what I actually wanted to devote my attention and energy to, I chose the Doctor of Nursing practice with the focus in adult gerontology, acute care NP. So I became an advanced practice nurse, and I absolutely love it. I have worked with nurse practitioners who are not acute care, but I've worked with them in all of my, practicing years in critical care and cardiac surgery recovery, and, the nurse practitioners that would come around. And that was my frame of reference for what kind of work I wanted to do. So I engaged, and it was the best decision that I could have made.
I love that. Once I think people get a taste for teaching, it really becomes a part of who you are and your practice identity, right? And impact. It made me a better clinician to be a teacher, honestly.
Yes, I 100% agree.
Yeah. So you became a full-time faculty after that while you were practicing?
I was full-time faculty before that. So I led the critical care courses in the baccalaureate program for a number of years before going back to school. I had about 13 years of experience of critical care nursing experience before going back to nurse practitioner school.
Wow. I love that. That's the journey you take, that teaching brought you into advanced practice. Lucky us. Yeah. So we're here today really to talk about educating nurse educators, and our specific bent, of course, at NPACE is advanced practice providers or nurse practitioners. But why is educating nurse educators so important?
Well, it's really important because, like myself, I came straight from the bedside into academia, and without the preparation of an educator. So I was registered nurse. I was licensed. I had a lot of experience. I was certified in my specialty, but I did not have any formal education as an educator. And I learned when becoming full-time faculty, I started as part-time faculty as adjunct. And then when coming on as full-time faculty, and this is still before I was a nurse practitioner, I learned that many professionals go into academia without the formal education of educating. And I think that lends to the significance of why we really need to teach professionals. Yes, they are expert at their clinical roles and jobs, but how to become expert in facilitating learning for learners. So I think that's where this program really synergized a lot of the experiences and efforts that we had here for the faculty I lead, and hopefully for nurses across the region that we touch and impact.
So tell us what that is. Tell us what LSU is doing. What's the project?
So the project, the $3.6 million project that you mentioned and alluded to, is a HRSA grant funded project for clinical faculty and preceptors. We named our project, there were 1 in 10 awarded in the nation, and we were awarded for Health and Human Services Region 6. We titled our project the Clinical Nurse Educator Academy. This academy aims to not only increase the workforce of nurses that are educated and qualified as nurse educators, but also to retain them as nurse educators. So it's twofold. The first phase of the program is a professional development program. We have the Clinical Nurse Educator Academy includes about 9.5 up to 15 hours of professional development credits and courses. These courses are at no cost to any licensed nurse. We have 5 modules, 4 being core and 5 being very role specific. We've developed the program to develop RN educators, nurse practitioner educators, and nurse midwifery educators. So that 5th module is where it becomes role specific. The second phase of this program is after we have developed the nurses in the role of a nurse educator, a clinical nurse educator, we then want to partner with them and schools of nursing and clinical agencies across Region 6 so that we can build a network between the qualified clinical nurse educators that support schools of nursing, but that also supports the infrastructure needed to educate learners in the clinical environment. So it's a lot.
Mm-hmm.
It's a lot, but those are our primary aims. And we've been pretty successful so far, especially with the partnership with NPACE.
So you said something key in there I'm going to build on. The audience knows I take rapid notes because I actually use all of this information later and we like to disseminate. But you said specifically that this is geared toward producing clinicians in the clinical environment. So does that include anyone who precepts nurses at any stage of education? Wow. Okay.
Yes. So increasing the workforce of educators among the nursing workforce to educate in clinical environments. So we have a workforce of nurses. There's lots of information out there about whether or not there's a shortage or if there's a maldistribution or where the nurses are, particularly after the pandemic. But we have a large workforce of nurses. We're the largest health profession in the nation. With that being said, all of our nursing workforce is not educated as educators. So that's what this program is hoping to do, is to build the capacity of our licensed nurses to function after having formal education in the role of a clinical educator.
Gotcha. I love that. So important. You also mentioned Region 6 a couple of times. Tell me who's in Region 6 and what that means for this project.
Yes. So the Health and Human Services Region 6 includes the state of Louisiana, the state of Texas, Oklahoma, Arkansas, and New Mexico.
Okay.
What that means is the grant funded us to specifically increase the workforce in that region of the nation. What we were able to do is provide the professional development program to all schools of nursing across the nation.
Wow.
So we market and recruit from the national, regional, and state level. So we travel a lot. We go to each state. We market at that level. But we also have partners like NPACE and NOF that we market with for the recruitment of nurses, because you have participants in all of these states, but also to support the workforce nationwide from a program that's already developed. What we cannot do outside of the region is stipend, recruit, or partner with nurses. In essence, the support, though, is that development, the program itself, and helping them develop as clinical educators.
Okay, that's great to know. We'll get to where I'll ask you in the end where people can go and find more information. So we'll hold that thought on that just popped into my head. But tell us what kind of impact you've had so far. How long have you been up and running? Or what does it look like, the program?
So thank you. We're in the second year of the grant program. We've launched the program starting the end of January, January 31st, last day of January. And since launch, so that's about 6 months, maybe a little over 6 months, we have educated over 500 nurses.
Wow.
About 460 are across Health and Human Services Region 6, and the difference are from many states outside of Region 6. To date, we have stipend and about 100 or so have completely completed the program. It may be a little more than 100. And of those that we know of to date, we know of 3 of them have completed the National League for Nurses Certified Nurse Educator clinical exam successfully on the first time. So we're still waiting for that data. It takes about maybe 2.5 months to complete the program if you're really persistent. So we're still getting that outcome data in.
Wow, that's impressive. I love that they're taking the NLN-CNE at the end. That's a difficult test, but definitely a marker for certification. What is the feedback you're having while people are in the program?
I'm so glad you asked. We've had lots and lots of positive feedback. Very little negative feedback. Actually, the negative feedback, I think, was just from technology and things like that. The positive feedback has been the program is easy to use. Wow, I've been a preceptor for so many years and didn't know this. Wow, I didn't know that there were learning theories. Wow, I didn't know that educators had to know this much. I thought that I was already a good educator, and that person probably was already a good educator. So a lot along those themes is the feedback that we've had so far.
How long does the HRSA grant run for? What are you looking at as far as time?
We are funded for 4 years. We're in year 2. We are wrapping up year 2, and we'll be heading into year 3 starting September.
Sure.
Yeah.
That's awesome. I love the feedback you got. People didn't know what they didn't know, right?
Yeah.
Until you showed it to them. That's fantastic. The tech I just smile about because we do on-demand learning too, and it's always an obstacle, right? We had it today getting in here, but once you get past that, it's so valuable. Do they connect? Do your students in this program ever connect with each other? Do they discuss things? Tell us how that works.
So no, we don't have, it's all asynchronous learning. It's all online right now. We will have live sessions starting in September of this year with different organizations that we partner with. But the online program currently with the participants registered, they don't communicate. It's just more about reflecting and self-awareness and building one own competence. Very good question, because we've even considered trying to integrate some discussion. The logistics in that will require certain time frames, and I think that might limit its ability to be disseminated to as many people. So we haven't included that.
Yeah. Working nursing faculty are incredibly busy. They just are. I don't think people realize how busy that role can be. So I appreciate that it's asynchronous. How do you think this is going to impact NP education? Certainly, it already looks like it is in Region 6.
Well, I really hope that this project and many other efforts that are funded by HRSA and maybe other organizations really not only develop the workforce, but supports the development of the infrastructure for clinical education, particularly for advanced practice nurses like nurse practitioners. We know that there are many, many health professions learners in clinical environments. And we know that the one profession that has governmental or federal support, meaning there's some graduate medical education funding for learners to be in clinical practices, that the only profession we know of right now is medicine. However, nurses have a very large workforce, and nurse practitioners and other advanced practice nurses make up a huge deficit of medical providers to so many communities. So I hope that this project can demonstrate to the federal agencies that help to fund graduate medical education or any other health professions education, but specifically nurse practitioner education, that it helps to support clinical agencies. Preceptors right now are asking to be paid. We know that. We know clinical organizations and agencies are asking to be paid. We also know that it can be disruptive to have learners within the clinical environment. So we know that there's some risk to mitigate, and clinical agencies do so without compensation. Preceptors do so without compensation. I'm not saying I support the compensation, the direct compensation of preceptors and agencies, but if we can ensure quality of that clinical learning experience, then I highly support there be some level of compensation for clinical agencies and potentially the preceptors that help facilitate learning on site. So I really hope that this project supports efforts like that. I hope we can continue it beyond our grant funding terms, or we get a new years of funding, because it's going to take longer than three to 4 years to do this.
Yeah, and you find things out, right? Every year you do it, you find things to tweak, or we should hit this more. I mean, that's the whole process of evaluation and reassessment. I appreciate what you said about clinical agency funding and preceptor funding. I think it's a discussion we need to have more, but also that we don't have much control over.
Yes.
And so anyone who's listening to this, there it was, one of the hot button issues is educating the educators without forcing them to go back to school or spend money on that, including preceptors. How do we get to them? But the other is paying agencies and what that funding looks like, and the risk mitigation and the quality. There are so many more factors in that discussion that we have to be talking about. So anyone who's listening, feel free to drop us a line with your opinions or share that, because we've got to be discussing as nurse practitioners the ramifications of that in an educational structure. We have to.
Yes.
Yeah. Because you said this was open to everybody across the nation, but especially our Region 6 listeners. I actually was at AANP in Nashville, and I had someone come by the table asking about the non-product specifically, and she lived in one of these states, Texas or Oklahoma, and said, I need to learn how to be an NP educator. And I said, well, here's who you should go talk to. You should go to LSU. I think you're in the region, but anyone in the US can check out what you're doing. So where should they go to do that?
Our main website has a Nursing Continual Professional Development tab, NCPD tab. On that tab, the Clinical Nurse Educator Academy will be listed as one of the programs. This is not an academic program. It is a professional development, formerly called CNE, or Continuing Nursing Education. So there is no tuition at this time because of HRSA's significant support of this effort. It is at no cost to participants at this time. In order to sustain this program in the future, we may have, NCPD credit costs, but
Sure.
it's not an academic program. So this is for any licensed nurse, registered nurse, or advanced practice nurse. This program can support their development as a clinical educator.
Okay, so if everyone goes to Louisiana State University to their Health Sciences Center, they go to your nursing page, they click on the NCPD, and then pick the Clinical Nurse Educator Academy. Out of that, they can find you.
Yes.
And right now, there's no cost associated with that, which is a big deal. Learning to be an educator is just so important. You really highlighted that. Is there anything else that our audience should know about your work with this?
Well, I think the piece that I didn't state is how important all of the competencies highlighted in the program are. So yes, you're learning to be a nurse educator, a clinical nurse educator specifically. How that's different from an academic nurse educator is that we don't go through test construction, item analysis, lectures, or classroom activities. What it does include is teaching in the simulated environments, teaching in clinical environments with direct patient care. And more importantly, it includes how to facilitate learning to diverse learners, diverse in every aspect: age, gender identity, ethnicity, culture, whether or not it's online learning or the student is from an online environment. And also how to facilitate that learning with diverse learners to care for diverse populations. So we know as nurses, we've always put the patient at the center of our care. We think about the patient. I usually teach my students that one great difference I saw in my sister and I, who's a physician, in caring for patients is, physicians are thinking disease oriented in general. This is not specific. Whereas nurses, we think of a patient who lives with a disease and that environment in which they live in, and that holistic approach. I think that this program gives that piece as well, is how to facilitate learning for medically underserved populations, for underrepresented populations, especially diverse learners. So there's that complexity that is threaded throughout the program.
I really, really appreciate you saying that for so many reasons. Coming from a nursing academic background, we haven't done a good job of teaching that to faculty so that we can be inclusive with our students, but also to affect patient outcomes.
Yes.
And it's mission critical.
Yep. It
Appreciate
is.
that you guys are doing that. You had mentioned something earlier about the NLN distinction of clinical nurse education, and it falls a little bit along those lines. Can you expand just a little bit on that, what the NLN says?
Sure. So according to their websites, I am not a representative of their organization. So I don't profess to be, representing them by any means other than what is publicly presented. And so there are two different types of certified nurse educator exams. I have the first one, which is the certified nurse educator, which is an academic focused. It thinks of classroom and clinical teaching, but it focuses more on theoretical facilitation of learning and all of those factors, including the way we assess learners and assess their knowledge with exams and exam analysis. The clinical nurse educator is less focused on the assessment of learners in any other environment other than clinical environments. So that includes where the clinical faculty takes a student to a clinical environment, like in RN programs, or for preceptors who have learners in clinical environments. It's also inclusive of simulation, because we know that simulation can help to give us that augmented reality of what direct patient care looks like and how clinical reasoning can look for learners. So it's only focused on that.
I appreciate that distinction, and I think it's so important to what we do, because clinical outcomes in the end are critical. I know NPACE is thrilled to be a part of this project, what we worked with in NOP and NOP building in that creation for what NP faculty need to know. That clinical module was really important. So we're proud that we can supply that to you in this. And we look forward to hearing more on how this goes in the future and getting reports and exchange of data. Thank you so much, Dr. Fowler, for sharing all of that. This has been fantastic. I hope we can talk more nurse NP education in the future. Maybe we'll talk about the DNP role the next time. That would be great.
Love that. I would love that. And I can't say enough how thankful we are for your support of this program, because without partners like NPACE and NOF, that it would be very difficult to accomplish such a great task.
Thank you. We appreciate that. Thank you for all your service. I know you're on lots of different things, and thank you to your service to NOF at holding an office there. It's going to be a busy few years for you. So we'll see you more. We'll talk about other nursing education things in the future. For NPACE listeners, you know we have on-demand products. You can go and check out what Dr. Fowler is doing with LSU and recommend it to any of your colleagues who are looking at being clinical educators. You also can see what we've got with NOP at learn.npace.org for new NP educators. So be sure to check out all things there. Thank you again, Dr. Fowler, for being with us on the podcast. It's going to be on Spotify, on Apple, on YouTube, on our Learning Center, and feel free to share it out.
Thank you. Thank you for having me.
Thanks for being here. And thank you, everybody, for tuning in.